Okay, it's 9 o'clock, so let's get started. And this webinar will be recorded, so we will also share you the recording afterwards. But welcome everyone on board and good morning. My name is Ilona Ylinampa. I'm the Deputy Managing Director and Head of Sales here in Fujitsu, Finland, and I will be your host and moderator for today's session. And our topic today is how can we create better technology and better healthcare? And what is the role of ICT in providing more efficient and human-centric healthcare? Next slide, please. So at today's webinar, we have an interesting session coming today. We have, for example, the ambassador of healthcare providing us really interesting information from the Ministry of Foreign Affairs. And then I also have together with me my two colleagues. Hanna Kivelä, the Managing Director of Fujitsu Finland, and Ville Väärälä, the Head of Healthy Living here at Fujitsu Finland. But before we go into our interesting panel discussion about better technology, creating better healthcare, I want to tell you a little bit about Fujitsu. Next slide, please. So what is Fujitsu? We're a Japanese company of approximately 130,000 employees worldwide, but we're very local here in Finland as well, with approximately 2,000 employees in Finland and Estonia. And we serve over 400 customers in the private and public sectors and also in healthcare. And we're really local in nationwide as well. So we have over 20 locations here from Rovaniemi to Helsinki and everything in between. And our revenue in last fiscal was 360 million euros, and we paid almost 90 million taxes. So working responsibly is really important matter for us in our daily operations. Next slide, please. And what is quite unique about Fujitsu is that despite the fact that we're a Japanese company, we have actually operated in Finland over 62 years. And we have really long history providing services for both healthcare and public sector and administration companies. And our roots are actually based in Salo, in southwestern Finland, where we started as a Suomen kaapelitehdas in the 1960s, which became Nokia companies throughout the years. And then we have also been working under Fujitsu Siemens, for example, in the last couple of years. And that's because really important that we're global, but we have really strong roots in the Finnish history and Finnish nation, and also plenty of customers here. Next slide, please. And our purpose is to make the world more sustainable by building trust in society through innovation. So it's really important that together with our customers, we're not only serving you as a national supplies critical company, but we're also innovating new solutions to make your work and your daily operations more smoothly. And we have four different this kind of customer verticals. We start sustainable manufacturing, consumer experience such as retail and finance, and healthy living for both public sector, social and healthcare districts, and hospitals, and also private sector healthcare clients. And then we're also very active in trusted societies such as municipalities, ministries, and government agencies. And we believe in making digital shift together with our clients to make their operations smoother. And we also operate with business applications such as SAP, ServiceNow, and other kind of applications. And we believe that the cloud transformation is here to stay, and there will be more and more operations going towards cloud. But in this journey, we also have to keep in mind that there are some data and some agencies and operations which cannot be made in the cloud for the time being. And therefore, we are a firm believer of hybrid IT strategy, so that something is on premises and something is in the cloud. Next slide, please. And actually, now I will hand over to our speakers, so you can briefly introduce yourselves, and then we can continue to the panel discussion. So Päivi, could you please introduce yourself, tell a little bit about your background for the Women of Technology webinar joiners today? And also, could you tell what is the latest thing that you have done related with technology and healthcare?
Thank you, Ilona. Yes, and hello, everyone. And it's really important that women are gathering around the technology issue. So feel very welcome, and I hope that we can then make it even stronger in your minds that you will stay in this field. So I am now working for a Ministry for Foreign Affairs as Ambassador for Health and Well-being. And I have a long background, more than 20 years, at different managerial positions, then in social and health service sector. I have been integrating primary and social and healthcare. Then in beginning of 2000 in Pirkanmaa specialized healthcare district, I have been deputy mayor in Tampere, and I have had two different director general positions in Ministry of Social Affairs and Health, but also 7 years there at the highest civil servant position as a permanent secretary before these 2 years in Ministry for Foreign Affairs. And during those, coming to what I have made lately, and what are the impacts I have done latest, I have to take up that during my permanent secretary time, I was leading the health sector growth strategy, which was quite unique, and which is quite unique globally. And there are three ministries: Ministry of Social Affairs and Health, Ministry of Economy and Employment, and Ministry of Education and Culture together have been building that framework for supporting the ecosystem that we can use health data and have a lively collaboration between private sector, then universities, scientific teams, and also then public sector. And now I am supporting the implementation of that growth strategy, supporting our companies in Finland and those solutions we have been developing in Finland, their export. I also talk a lot at global level panels and do presentation and discuss with ministry personnels in different countries, so that we can open doors and make it more adaptable, the environment there in different countries for these technological solutions we develop here in Finland. And then I also participate in global discussions where we also are discussing about the regulation framework regarding AI and digitalization in health sector. So this, and the latest one is that I was in Israel. I was discussing there with their manager in Israel Innovation Authority, and the director said to me that there are few countries that they are interested in sharing knowledge, and Finland is one. So we are now then building the relationship even more deep in the Finland and Israel collaboration. Thank you. Over to you, Ilona.
Päivi, thank you very much. Very comprehensive and interesting background, and we're really excited to have you today in the panel. Maybe next, Hanna, our Managing Director, you could introduce yourself. And I also want to hear from you, what is the latest thing that you have done related with technology and healthcare? Please go ahead.
Thank you very much, Ilona, and good morning, everyone, from me as well. And as Päivi said, having more women in healthcare or technology industry is good, because diversity is excellent, and it can create better results in many different ways and forms. So in my role as Managing Director, I have been actually here at Fujitsu since beginning of this year, and working very much and very closely with many of the healthcare providers in the wider ecosystem. Before I go into my latest experience, actually a little bit about the past. So I come from the global tech industry. I have lived in Ireland and working with Netherlands, and have the opportunity to work with many of the most advanced global giants like Booking.com, Uber, and others, who are really utilizing data and technology to accelerate their businesses and transform their businesses. And that is the flavor that I see as actually an opportunity for us here in Finland as well. Really, I think, Päivi, you mentioned it well in your opening as well about the data AI. But then what we have been doing and what I have been busy with lately in healthcare is that actually with Fujitsu, we were just recently chosen to be a partner for Valvira, which is a national supervisory authority for welfare and health. And we have been chosen to implement for Valvira the new service provider register, which is called Soteri in Finnish. And this is one of the greatest examples where we really bring the data to empower and enable the wider ecosystem. Of course, as Ilona, you mentioned well, is that we definitely work very much in this, but also in other areas with partners like InterSystem, Microsoft, and many others. So a lot happening lately.
Thank you very much, Hanna. And then handing over to Ville, our head of sales. Oh, sorry, head of sales in Healthy Living. Please introduce yourself. And what is the latest thing that you have been doing? I know that you're doing a lot, but what would you like to raise?
Thank you, Lena. About myself, maybe shortly, my background. I think I'm not the typical person to work in the IT field. My background actually is in behavioral sciences. I graduated to become as a classroom teacher, but I haven't done that work at all after my graduation. So I started working third sector and actually in labor markets before starting my IT or ICT career. And this is where I have become, or we have been ended in the last 5 years working in Fujitsu. But I think the main philosophy what I have always had is that it's always about the people. We talk lots about the technology, but we need to remember that people are creating technology and people are using the technology. So I think the technology is an enabler, and I think in especially in healthcare or well-being, there's a huge possibility to utilize those innovations to create well-being. And from that perspective, I'm truly a believer. And for the latest thing what I have been working in the healthcare area, I would like to say about our advisory board, what we launched we launched in the spring, but we have a first meeting coming on 1st of November, where we are collecting people for different industries, different organization, and also from the different services perspective to have this joint conversation, how we can actually, what we can do together in Finland to make our world at least a little bit better place to be.
Fantastic. Thank you very much, Ville. And I just want to highlight that it's really important that we have this kind of webinars, and Women in Technology Network is doing a fantastic job, and we're happy to be partnering with them as a Fujitsu to empower the women's career and choices into technology to improve diversity and also equalness. So we're really proud partner of Fujitsu, Women in Tech, and hopefully you can get some really insightful information in this webinar. But next, let's hand over to the panel discussion, because we all know that, for example, in the Finnish nation, we're under a major transformation under the social and healthcare transformation. We have the aging population and these kind of matters. So what could we do to have better technology in order to have better healthcare? And Ville, do you want to tell a little bit more about this before we jump into the panel discussion?
Yes, shortly my kind of opinion, I would say that the situation where we are living right now is that when we know that the population is aging, we know that we are struggling with our budgets and funding, and especially right now when there's lots of different crises happening everywhere, not only in Finland, not just only in our healthcare system. So we are living in a world that uncertain is certain. That's the only thing what we know. I would say that the hard question is that, or the difficult question is that, do we afford to have this kind of healthcare welfare system what we have today in Finland? My statement is that yes, we have, and actually we have afford to have a better system, better healthcare, better welfare, better social care. But it requires remarkable change. And my perspective is that the remarkable change is that we need to focus on prevention. We need to focus on how to utilize the digital tools. We need to focus on self-care. We need to focus on people. Now we have a tradition to focus on organizations and processes, and we are quite good at that. Actually, all the media says that we are top of the world what comes to the efficiency of healthcare, about efficiency, how we are providing the current healthcare in our population. But I think in future that's not enough. We cannot tweak that organization anymore better, or we cannot tweak those processes. At least I think that we have tweaked those processes a little bit too much, actually. But we need to change. We need to change the way how do we work. We need to think about that future. We need to focus on the future. What are the things what we need to work differently? How we are able to efficiently utilize the technology in the future.
Thank you very much, Ville. And I think we all agree that we need to make both technological and cultural changes to healthcare to better cope with current and future demands. For example, the aging population and rising costs and these kind of matters. But I would like to ask now all the panelists, how do you see the megatrends and major challenges in healthcare in Finland and more globally? Could you give some examples? Päivi, do you want to go first, for example?
Yes, thank you. I think that we all are looking not only what is happening inside, but at the EU level and then also globally, because digital transformation and use of AI is not a national thing. We can do a lot nationally, and we have done actually in Finland a lot. We have the world's first legislation for secondary use of social and health services. We have very we have a very one of the most digitized countries in world here. But if the data is not crossing borders, if there are different kind of legislation and regulation in different countries, we can't use the potential we have in the era and where the technology gives really much and pretty much possibilities for us. We can't proceed towards personalized care either. And I think that people don't actually understand that the personalized care is really linked to and very deeply linked to the use of data and willingness to give your data to be used in research and development, but also have collaboration with private companies who actually do the solutions we use. And therefore, I see now that the COVID pandemic then give a big boost for countries to digitize also their societies, because you have to digitize first your society and have the infrastructure available, but also the know-how to use the technology. And we Finns have that. That was why it was so easy for us then to really jump to the remote use of services and working during the COVID time. But not many countries have that potential and know-how and infrastructures yet. So that's why we have to then work and talk and give our showcases with what we have done here in Finland at the European level, but also at the global level, to be able to then make the atmosphere more positive and understanding of that it is really possible to use the health data so that you can have respect on human rights and privacy issues. And EU has launched in May the proposal for European health data space, which is actually the legislation for secondary use of the data at EU level. And it is the Finland then coordinated the preparations towards that proposal. And now it is really important that people understand what it means and give support to their politicians to be able to make then the decisions that we could have that kind of legislation here at the EU level. And I see now that this is very crucial for Europe, because if we now have more narrow possibilities to use that data, that will then make this region not so interesting for companies to do the research and development. We can't actually think that all the technological development will stop then if we decide here at Finland or at the EU level that no, we are not allowing the use of the data. That will go then, companies will go then, and the technological development will go then to Asia and to US, and not all countries and not all regions have the same kind of respect for human rights and privacy than we. So that's why I see it really crucial for global and for also the most vulnerable and women and girls in low and middle income countries, that Europe is really active and Finland is really active in developing the solutions that are the ones which are used when the health systems are being strengthened in those countries. So this is a view I am looking for, but I see a lot of potential here in Finland. We are ready and we can pick the fruits now from what we have then built for decades. Sorry for this long answer, but then over to you, Ilona.
Thank you very much, Päivi. I think you mentioned very fruitful things. For example, of the global role of European Union in this data economy. We cannot, stay inactive in between of, America and Asia. We have to be really united in the European Union. And also you mentioned about the role of legislation. I think it's really important part as well. And also about the preventive role of healthcare and how me or you as an individual, we have a role in this preventive healthcare and how we can, give our approval for accessing the data and how we could benefit as a nation from it. So I think really good points. Hanna, do you want to continue from this? How do you see the mega trends and major challenges in healthcare in Finland and more globally?
Yeah, very much so. And Päivi, I actually agree fully with what you said, and building from that, because it's really about the accessibility of data and how we can use the data to create and shape in very inclusive ways with the help of technology, the services to all people. And so that's definitely important. There is an element that I think, Päivi, you mentioned also briefly in your commentary was around the trust. So to ask people to give their data, there is definitely the element of trust, that how can you make sure that with all the, well, of course, it's the mentality, it's the legislation, but it's also the right and smart use of technology. How can you create that environment of trust so that people are willing to give their data when they know that it's used wisely and well and in ways that are helpful for them? And I think that this is really the integrated connection between the technology and data, and even then the cultural change combined, how people are then using the data. Ilona mentioned in our opening, or in your opening, our purpose statement, which in essence is actually about building trust in society through innovation, and with that making world more sustainable. I actually think that that is something that we as technology providers, we have a great role, and we also have a great responsibility in making sure that we really use the technology well, and we use the data well, and provide an environment where the data can be used very well. So that it's secure. We know cybersecurity is a huge topic these days. It has been already for quite a while. But when we talk about healthcare, health related data, security is definitely top of mind, which needs to be always built in many ways. And then, of course, the democratization of the data. How can the data be used so that all people have equal equal access and equal availability of their own data, so that they can use and benefit from the services. And I think that that's really, even the topic of today is partly the inclusion. So when we combine technology and data, that then creates services and allows us to create services that make healthcare advancement available and accessible to anyone. Even in Finland, when we think that we are this quite long country, there are people who are living maybe somewhere where they don't have immediate access to the best university hospitals. But actually, when we think of the empowerment that digitalization creates, only in Finland, it's fantastic. But it requires the data, as you very well said.
Thank you very much, Hannah. And I think you really pointed out very well about the trust. It's about the trust towards the society and European Union, but also trust towards, every organization, whether you're studying or where you're working at somewhere. It's about trust, and which has to be in all the layers, and also about the cybersecurity and the important role of it. Because, for example, the global cyber crime damage that we get each day, it's 200,000 per second, which means 16.4 billion per day. So it's really massive amounts that we're talking about. And especially if the cyber crimes are related, for example, with healthcare or people's personal data or these kind of things, it's not only about damage that we have, in valuable in euros or dollars, but it's also about the damage that we have towards trust, which is kind of like preventing us from using the digitalization. But before we move into our next comment, Ville, what do you have to say on this topic about the megatrends and major challenges in healthcare?
Yeah, I totally agree with the previous speakers. Really important points. One thing actually is when we talk about these kind of megatrends and major challenges is that we need to talk about the my data also. It's related into the trust, because actually when we talk about the health and welfare or social care, we are talking about the systems. We are talking about the official data, how to utilize the official data. But by the end of the day, actually the huge and probably, at least in the future, most valuable data is the my data. It's the data about my environment, about my behavior, about what I'm buying from the grocery store. For example, my good friend, MD Antti Ivan, sometimes asked from me that, Ville, by the way, do you know where is your nearest health station? I was calculating, yes, I know, I live in Helsinki, and the nearest health station, it's about 2-3 kilometers away. And he said, no, it's the nearest grocery store. Because if you actually think what affects your health and well-being most, it's actually the grocery store. It's what you eat and how do you do it? What are your daily activities? That's actually the most relevant of your health and well-being. And that actually opened up my mind a lot, because we are talking about the data. When we talk about data, we sometimes struggle to have the organizational data. We need to widen our eyes and think about all the data, my data, all the data, what is possible to have, and also have the possibilities to persons share that data. So it's not about the organizational data, how people have the trust, but also that they are able to become as a target of acts as an active person to be involved for their own health and well-being.
Very well said. And thank you for emphasizing my data, and also emphasizing that the closest doctor or hospital is actually a convenience store, and where we buy our food and our daily things. And moving from this, how do you see that digitalization and advanced technologies can help tackle the challenges and make healthcare more sustainable? We have been a little bit dancing around the digitalization topic, but how do you see that this can make it more sustainable, but also help democratize healthcare and restore the trust of people in the healthcare? Ville, short comments, and then moving over to Päivi.
Yeah, short comment. Actually, I'll just give an example. The example is that one project what we are working together with the Helsinki University Hospital and Helsinki University and Aalto University, where we are working with gestational diabetes. And what we are doing there, actually, we are not creating some fancy technology. We are actually making the data visible for the pregnant women and of their behavior. So we are providing the information about their activity, their nutrition, and their blood sugar levels. So to get the patient involvement to see that how their daily habits are affecting their health. And of course, we are gathering we are not gathering, the university and Helsinki University Hospital is gathering the data to create the algorithms, to create predictive models for the mothers to show that if you do this way, your life is going to be better, or if you do this way, you have risk to getting the diabetes or in further stages. So I think this is about the patient involvement in the long term.
Thank you very much, Ville. And what I really loved about your example is that it's not only affecting the pregnant woman, but it also has a next generation impact. So it's really creating the trust towards society and making us really involved. Päivi, how do you see that digitalization and advanced technologies can help tackle these global challenges, the local challenges that we have in Finland, and make healthcare more sustainable?
It's not a one night act you can do, and Finland is a good example of that, because we have been building this data economy society actually since 1950s, when we began to gather cancer registers, for example. But then 1960s, when politicians from different parties then decided to begin to build the welfare society, which is based on taxation, then they needed to establish an identification number and began to gather then data to different registers, and then have legislation which then is behind those registers and authorities who take care of them, but then also make a supervisory processes so that people can then build trust that when our data, which is linked to our identification number, then is in different registers, and not only health register, but socioeconomic register, because as Ville said, behavioral information is so important if we are going to have then useful AI solutions to help our everyday life. So it has been a long way then to make it possible to have data available and have it safely there. But then to build trust, you need then to give then people services and show that when you use that data, it will then ease their everyday life. And that has happened in Finland. So people have been used to get in other sectors than health sector, then digitized services. And that's why they are also asking that from the health sector. So it is totally different history and background to build on then the new technological solutions then also in healthcare in Finland. And that's why we have to be then very loud and at the regional, but also at the global levels, to really show that this is possible. And I mean, it's amazing when the people are like amazed when I tell that, yes, last spring there was a study where we asked from our people then that are they willing to give their information and data for use in health, their health data for use and research and development, and 80%, regardless of the gender, then were willing to do that. I was participating in Austria, their e-government and e-health day 3 weeks ago, and they were like, what? Because there are, and in Germany there is not that kind of trust, or in any other countries either. In Japan, for example, they have identification number, but as I remember, for some years ago, it was 10% of people who were willing to give then linkage from the data to that identification number. So this is a big thing that we have to work on globally and regionally, because you have to have that kind of data available. And as Ville said, also other than health data, because people are gathering actually in different countries. They have different kind of devices and wearables. They are gathering their data, and they are sending also that data in many places. And that's why technology companies has to also be responsible, as Hanna said, that why we do not yet have legislation or regulation for that. So if the technology companies then show that they can handle that data securely, so that then also builds trust for research and development. But yes, I think that there are now a lot of potential in Finland, but also globally. But we have to now first build awareness between the data we are gathering and then the use for people, that they understand that it's really crucial to have that data, and it is not linked to you. There are processes and ways you can handle that data so that it is not linked to your identification number. So it is anonymized or pseudonymized, and there are processes that because that data is really needed, because research and development teams, they have to understand the different cohorts we have. And then when I go to see my doctor when I get ill, then the doctor can really compare my biological and physiological status to cohorts which are similar than mine, and then I can get more personalized care. But this is now a really big issue actually in Finland also. We are having in our parliament the genomic center legislation proposal from government. It is in parliamentary discussion, and I really hope that we can get it through there, so that we can also have legislation how we can handle then genomic data, which is actually not in my decision making, that would it be possible to use that, because it has a really big impact to my children, to my other relatives also. So genomic data is really powerful. It can help us a lot, but it has also much wider relation to other people than the traditional way we have used other data from our health status. So this kind of thoughts.
Thank you very much, Päivi. There were so many good insights. I have to summarize something. So you discussed lots about the behavioral information and how it is crucial for useful AI solutions. For example, Fujitsu has been working with Etelä-Karjala Social and Healthcare District Exote, and we created this kind of Nuora AI algorithm, which can actually recognize the young people in the risk of social exclusion 6 months in advance. So it's part of, how do we use our what kind of words we use and how we can, pick up the right people so that we can help them in advance. So it's really about the preventive information. And I like the word when you said that we have to have useful AI solutions. So it's not about having AI, but it has to have some advantage in our everyday life. And thank you very much for also reminding us of the ease of everyday life. And I think that can be really well noticed in the 80% of who gave their permission in this survey. So it's really, really fantastic. But then handing over to Hanna, how do you see that? How can digitalization and advanced technologies help in tackling these global and local challenges that we have? And for example, how can digitalization help tackle the labor shortage that we have due to the aging population, for example?
Very good questions, and I think that if I answer 2 parts, first and foremost, I think digitalization is a necessity for all of this, and I was really felt even proud, Päivi, when you spoke about the Finland, the journey we have taken, and I think that here is a bit of a learning for us that we need to to bring us to the podium and say that we've been working there, we have been doing this, we've been solving, and we are committed to solving for the future. But there is also the lens when using the word we, I think that we as an ecosystem. So it's not only Fujitsu, it's not only hospital, but I think that what you, Ville, mentioned in your commentary was really around that it's the human being in the center, the groceries and all that. So how can we really in Finland bring all the different parties together to solve for the human centric, really having the people at the front and center and thinking how can we help them? So this is the one part where I think that really working together as an ecosystem, and therefore the advisory board that Ville mentioned is actually an excellent way, and this conversation is an excellent way. How can we solve for that together? So that's very important. Then the other question is really about the labor shortage and how can we actually create more opportunities and really find ways to have the right talent working and solving for this. That's again, I think, something where we have a responsibility, not only technology players, but we all in Finland thinking that to solve for human needs and solve for healthcare with the help of technology, you need to have actually broader perspective. There needs to be strong technological capabilities, but there needs to be also very diverse talent, someone who understands the healthcare context and someone who has been working there. Think of the nurses or doctors and all that. If I may be a bit bold, I think that we in Finland, when we talk about technology and even in public tendering, sometimes some public tendering processes, when thinking, okay, who can work in this area, we are limiting ourselves. And we are thinking that you need to have a certain level of PhD or certain ICT experience to solve for the technology needs in healthcare ecosystem and needs. We need to open up. And I think this is something where it goes back to, I think, well, Päivi, you spoke about the legislation, but it also goes into our behaviors, how we buy ICT and technology in Finland. We need to open up and really think that we have a human being at the center. What different experiences, what different capabilities do we need to solve for the needs of these people with the help of technology? And it's a hot topic in Finland these days, I think, in many ways when we talk about the labor shortage, but it starts from, so what do you ask even in public tendering process? Do you ask what kind of profiles? Is it okay if there is someone who is not a Finn by origin, born in Finland and things like that? And this is the challenge that I really want to put out there for all of us to think of. How can we solve for the human beings and bring in inclusive ways the very diverse talents, even when we are talking about technology procurement?
Thank you very much, Hannah. I really thank you for reminding about that this is actually bigger than us. So that's why we have to see the big picture. And also, for example, the Fujitsu advisory board that we're doing together with our customers, but also with our competitors is really important because it's not about what Fujitsu does or what company A or B does. This is really a massive opportunity for us all. And also, I like the fact that you were mentioning about the broader perspective that, for example, when we're hiring people or when we're doing researches or whatever we're doing, we have to have the diversity in industry domain expertise. So it's not only about IT architects doing, this technological transformation. The doctors and nurses and social workers really play a crucial role in this. Ville, what do you have to say on this topic?
These are really important things, and I would like to give an example. If we think about the equality, we think that everyone has same possibilities to have same level of social or healthcare or well-being. Is that true? No, it's not. We need to admit that it's not true right now, and we need to find anomalies behind that. Also, there's challenges when we talk about the data security and those kind of areas that we have right to secure our personal data, but at the same time we have right to have the best possible healthcare. So this is also ethical question and challenge sometimes what we need to resolve. As an example, currently we have the technology available to collect the healthcare data and analyze and find risk factors. But can we efficiently do it? Can we analyze that data in the way that, someone contacts you from the hospital or somewhere else? Okay, we find from your data that you should have the blood test because of this and this and this. And now we have this dialogue going on. Is this possible? In which way this is possible, and what are the challenges of that? So we have the right to have good care, but we have the right to have our data handled in a secure way. So these are, and this I differently agree with Hannah what you said, that this needs different kind of knowledge, different kind of understanding, different kind of background from the persons. And I think the same thing is that, you know, some doctor actually said to me that, you know, in the healthcare system they shouldn't have the visits in health station just to collect the blood pressures. And I said I disagree with you, because at the same time when the nurse or some other healthcare professional collects the blood pressure from the patient or from the patient, it also asks the questions, how are you doing? It sees the person how is walking or doing things. So it's not just collecting one data entry. For collecting that one data entry, it's expensive, but it's actually really important thing to have the face-to-face analog encounters, I would say that way, or situations where people actually meet together. But what we need to do within the data to optimize these things, we need to know the kind of the population or the groups, what we really need to get into the health stations to have these meetings. And there's a huge amount of people who don't, by the end of the day, they don't need to be handled in those areas. That's my perspective of things. I think Päivi, you have some commentary on
this. Before we go into Päivi's comments, I just want to remind our audience that we have 15 minutes left. So if you have any questions or comments, feel free to write them to the chat so we can ask our panelists later on. But Päivi, please go ahead. You have some comment on this.
Yes, actually, I wanted to continue from what Ville pointed out then about the use of data for preventive purposes and the discussion we now have here. I think, and I have seen, and we have all seen, I think so, that things evolve step by step. And when we have cases and showcases, they build understanding and then also willingness and then permission to proceed. And we have now been going on in Finland so-called FinGen project, where we have been collecting 500,000 people's genomes. And nearly all of them are now sequenced, and the data is coming back to our biobanks. And there was then discussion and that no way we can't have that kind of legislation where we can, after the anonymized data has been analyzed, that there would be then going back to the identification number so that we can then identify the person then after that big data analysis, and not take contact to people, that there are some kind of constitutional challenges to be able to contact persons if we have seen risks there. So this is the discussion we have had. But now, when the data is coming, the sequence data is coming to biobanks, and physicians have been asking that, okay, if we can now see risks, for example, to certain cancers, they would like to have the data and then contact people, because physicians say that they don't want to be in situation where people come and say that you knew and you didn't do anything, you didn't contact us. So we have to have this kind of discussion also going on. Fortunately, we have in our FinGen project the possibility that people have tagged that yes, you can contact me if there comes some risks. So this is the way we can handle this kind of situation, and perhaps we need more this kind tackling and possibilities to allow then to take then contact if the risks are being analyzed there. So I think that this is a good example where I think that the awareness building really comes, and there comes then from people then push towards politicians to make the decisions that these kind of connections are possible. Then I always would like to take the kustannusosakeyhtiö Duodecim has so-called health benefit analysis, and we have been working with Fujitsu at InterSystems and with them also in having this kind of collaboration. And I see it really important that Finnish companies and international companies work together, because Fujitsu and other big companies are already in many countries, and that gives possibilities to our small companies then to also have their solutions delivered then and available easier. So that is one where you can, where a physician can then analyze the risk patients and take contact and focus more on them. And then one global example also, there is a small company, technological company, Neuvo Inc. in Finland, who has been actually building a sustainable way of doing their business, and they have been focusing more on developing countries, and they are working with Nokia and UN Women in Kenya now, and they have a solution where they can have Neuvola in their in mobile phone, so giving information to people, not services so much, but then information sharing. And now they have the coalition have in Kenya a pilot study regarding gender-based violence, where you have then information in your mobile phone deliver that for population, and then there is also a button if there is an acute case, you can push that, so you can that people could have information about services and also what the gender-based violence is, the awareness building about that. And I think that these are really important examples of how we can really use technology to help people and vulnerable people in also other countries than in Finland with Finnish solutions.
Thank you very much, Päivi. And that actually is very good angle to our question that we got from the audience. And if you have, by the way, some other questions or comments, feel free to write into the chat. But here is mentioned that there are so many sides to consider, as we have also been discussing. It's about legislation, trust, the technology itself, the people, how we do get them on board, etc. And Ville says that the analog encounter is important, but there are not enough nurses in many institutions and they are overworked. Or we digitalize to help elderly people, but can they adapt to new technology easily? Will we exclude them with the effort to help them? Also revising the patient education, for example, in the case of gestational diabetes and so on. So here are really many things to keep in mind. And that actually brings me to my next question. What do you see that it's preventing or do we have some obstacles? For example, we have just been discussing about legislation. Perhaps there's an investment needs that we would need to have. But foremost, I would also like us to discuss a little bit about the culture change, because it's not about that we start to use some tool or some process or some digitalization itself, but how does it affect our ways of working, or as a patient or as a customer, how does it affect my route in the process into going to see a doctor or preventing myself from some diseases? What do you have to say on this? Päivi, do you want to go first?
Yeah, I would like to start. Yes, about the elderly people, actually, we have quite many solutions that old people are using and our seniors are using. So there are a lot of them who are very capable of using. But we also have processes and give financing also to that kind of activities where seniors that have the digital know-how, they then teach the other ones. But also then in quite many homes where old people are living, we have if they need home care, there are tablets, and we can then discuss and have a dialogue with them through those tablets, and there it has been a success. So we have to, of course, teach our seniors, but all of our people to use this, but it has been a success. So I see here no burden. So there is a possibility to do solutions that everyone can use. And if there are then groups, we have to also have available a traditional way of giving services. So we have to remember also this, that there is access for everyone. And nurses, there are then of course we are lacking nurses, but technology can on the other way then help them to connect and focus on the most important things. Is if we can then have technology who can then remind you of taking medicine, and the locks of your medicine box opens only when you that box when it's right time to take them, and there comes an autonomous reminding of that. So there are many kind of technological solutions we can help then nurses to then really focus on their the most important things they need. But there is a lot to do also in Finland for that.
Thank you very much. And very short comments, Hanna and Ville, because I have one more question that I would like to ask you all.
Yeah, just a comment. I think that when thinking of the Finland and the inclusion point of view, we are #1 in the world when we think of the digital economy and society. So we are really on the leading edge, and we have the connectivity, we have the capability. But from the point of inclusion, I think what you probably well mentioned is that, like, I love the example of Neuvo. They are designing for 2G connections to make sure that everyone has equal access. And this is the angle where I think that we can benefit a lot by being in Finland with all the connectivity and all that, so we can push the boundaries. But let's think that there are also those, especially globally, who don't have equal access. So how can we design flexibility in that scene?
Thank you very much. And Ville?
Yeah, I think it's a question that how many of us think that it's not necessary to visit in a health station or hospital. I would like to do it in a digital way. We need to know those kind of that part of the population who are willing to use the digital tools, and from that perspective are of course more cost efficient and won't take the time of the nurses or other healthcare professionals. But I think current cultural change needs is to understand kind of the patients or customers, understand their different needs and provide different patient or treatment journeys. And that's what we need to innovate. And that requires the cultural change, what you talked about.
Thank you very much. And I have one more question that I would like to ask you. We all agree that Finland is the forerunner in many things, but still Europe as a whole, we need to become more relevant in the global data economy so that we can really answer to our American and Asian friends. How do you see that the future of Finnish healthcare sector and also the export market looks like? What kind of visions do you have in the future? Short comments. Ville, do you want to start, and then Hanna, and then over to Päivi?
I have had chance to get to know a lot of different countries, a lot of different areas. Also, from the internally from the Fujitsu companies, but also in other perspectives. And as Hanna stated, also in this area we are in the top 10. We are in some areas we are the top 1. So and we have the knowledge, we have the innovation culture, we have the. I think the Finland is more enough market area that we kind of know each other. We have the trust between the different organizations. We have the capabilities to innovate. I think we are a bit challenging how to make those kind of export solutions. We have the challenges for that. How to take that giant leap, how to make it visible. So we need to be more bold of us. I think we are too modest comes to the Finnish culture in some way. We need to be bold. We need to be, we need to say that, we are the best ones. We know how to do it. We can help you. So I think we need to be bold.
Yeah. So commercial side in addition to our strong engineering field.
Yeah.
Hanna, short comment, and then over to Päivi.
Definitely so, and I think it's about, we spoke a lot about trust, but we need to trust ourselves as well. I would like to see that we really work hard on pushing the boundaries, and there are things we spoke today about the data, AI, technology, how to do it in very responsible ways. And I think this is the kind of a thought that I want to give us, that how can we, in everything we do, we keep the human being at the center. So not only about technology, but it's actually really solving for the complex healthcare related problems or opportunities with human at center, and then making the technology work for that together with the whole ecosystem. So I think that we are already at the top league there in Finland, and we can be the role model for others how you do it. And I loved listening again to Päivi, how you explained everything, why we are here. We have the history, we have the capability, and we have the culture.
Thank you very much. And Päivi, what do you have to say?
Excellent points from Ville and Hanna, and I would like to add here that we need then, in the implementation of social and health service reform, we need to have their structures and processes for research and development, and the culture that it is must to do the collaboration between private sector, science societies, and then also public sector, then together the research and development there, because that is the only way that we can renew then our own systems also. But we need to have the culture for research and development, the same kind of culture we have for academic research in social and health service. So that is what I would like to have in the implementation of social and health service reform. And then for next governmental program, we need a strong focus also for this health sector growth strategy implementation, so that we can really have resources for supporting the export and then picking the fruits that we have now here in Finland for having also money coming in for our welfare society, for all those technological innovations and know-how that we build then together with private sector and civil society, public sector, and researchers.
Thank you very much. And I would also like to thank the audience for your interesting questions and comments, and also our panelists for today. And please keep in mind that at Fujitsu, we want to work to enable the innovation in the trusted society. And also, we're a really proud partner of Women in Tech. And as we have seen today in our discussions, technology is really diverse field. So you can be everything from class teacher to all this kind of deputy mayor and everything in between, and still be passionate and work in the field of technology. So thank you all very much. And shall you have any questions or comments, feel free to reach out to us afterwards as well. So wishing everyone a nice day, and let's keep in touch. Thank you. Bye-bye.
Thank you. Bye-bye.
Thank you. Bye-bye.